Good afternoon, good evening, good morning, wherever you are in the world. Welcome to Craft Cannabis TV. I'm really happy to be speaking to the gentleman on your screen. His name is Dr. Felice, and he comes from Seattle, Washington, and runs a naturopathic pain clinic. I'm going to ask you exactly what that is for people who don't understand. You do lots of things, so there's a few things I want to spitball and throw into the mix. Apparently you've got a black belt in Aikido. Is that true?
Yes, it is.
Yeah. You lived in Japan?
I did for 5 years.
You're a surfer. I know you're a surfer. I've seen some pictures. I believe you play the flute.
I do. I would consider myself a folk musician. I'm far from an expert, but I love to play, mostly live and by ear.
Okay, fantastic. You're also a podcaster. You've got the Cannabis Matrix podcast. I believe that the Cannabis Matrix is also expanding to something, so I'd love to talk about that in a sec. And you're a teacher
Great.
and a speaker, and I would like to call you, if you don't take offense to this, a cannabis genius. Your depth of knowledge is unbelievable. So I really respect what you've done and learned and how you're teaching this.
Well, I've never heard myself called that before. I feel that with, and we can get into this, but I feel that with plants, there is an immense amount we can learn from books and studies, but also we learn about plants from other people. I learn about cannabis from everybody, even folks who do not believe in its efficacy at all. And so I feel that this plant has a way to help us move forward as humanity, not only as individuals, but also on a societal level as well. And we'll probably have time to chat a bit about that. So
absolutely. Well, you're also one of our advisory board members on the Cheeba Cannabis Academy. So we're super grateful for your time and energy you're putting into that. And, you know, through our partnership with Medical Marijuana 411 in the States, we met you and got introduced to you. So it's really nice to connect. You know, you guys have, I think it was Denver in 2001 was the first state that decriminalized cannabis. So you guys have been at it for sort of 19 going on 20 years. We're kind of 2 years into our journey. So the knowledge you have in the medical space is fascinating. And we're really honored and privileged to have you sharing that knowledge with us. Is there anything else you want to tell us about that you do before we carry on?
I really see the word doctor as comes from the Latin docere, and just like in the Japanese, doctor is called sensei, teacher is also called sensei. With the Latin docere, they did not differentiate between a doctor and a teacher. I think of myself as an educator, is even more than a clinician. I think that that's one of the main roles as a clinician. So education is something I'm passionate about, and I love being in the classroom. Amazing.
Teaching is a very powerful thing, and helps us learn ourselves as we go through this journey, you know. So let's get on to the topic at hand, which is cannabis and health and wellness. And I want to start off with one of the sort of broader areas that cannabis is helping people with, and that's pain management. And through your clinic, which specializes which is a pain clinic, to talk to us about cannabis and pain and how cannabis can help us with pain.
Okay, so pain is an immense topic. And so many of us have pain in our daily lives, and many of us will cycle through periods of pain. So it's something that a lot of people can relate to. There's something called the endocannabinoid system. Also, you'll hear me say ECS. Endo means inside, cannabinoid refers to the cannabis plant, and system. So we have in our body a natural cell receptor communication system that cells use to communicate with each other. And it is very important both in the perception of pain and in the transmission of pain through nerves, as well as how the brain interprets the pain. We have very high levels of cannabinoid receptors in areas of the brain that control pain. Also, out in the periphery, so to speak, hands, legs, outside of the central nervous system where we typically experience pain, we also have cannabinoid receptors there. So cannabis works on pain on a number of levels. It is not a massive pain reliever. I think of it as more a mild or moderate pain reliever. Because it is present in the periphery, because receptors are present in the periphery as well as centrally, you can utilize topical products and oral or central acting products at the same time. So if you are a patient who has pain and are using cannabis orally, for example, you might be able to have an extra benefit from a topical product and combine them together to get a little bit more relief. Also, whenever pain is encountered for the first time, we'll instantaneously see the body's levels of pain of cannabinoid receptors in the pain centers elevate. So this system behaves. The ECS that the cannabis system runs on is a very fluid system. So the receptors are constantly changing their levels. So that has to do, that has implications for dosing, which we could always talk about. And the other thing that cannabinoids possess is, in addition to things that modulate the pain signaling, they have anti-inflammatory properties, which can also be applicable for pain as well. And pain, I think, is one of the things that cannabis, we can say, definitely does. It's putative, meaning it's generally accepted as true that cannabis is effective for pain. And what we've seen in the United States, which is very interesting, is we have an opioid epidemic here, worse than in a lot of areas of the developing world, believe it or not. And it has been, the opiate-related deaths have been steadily increasing since about the year 2000 to where we are today. Statistically speaking, they're killing about twice as many people as automobile accidents in the United States, the opiate medications. And every time a new cannabis law comes into a new state, we see an immediate downturn in the numbers of opioid-related deaths.
So I just want to dig into that a bit. So this is, my next point was actually opioids. So you've led beautifully into that. Just explain to us, so the opioid deaths are happening, why? What is the reason for those deaths happening?
Well, there's a lot of pain. I can speak to the U.S., but globally, as humans, anytime you hit the age of, I don't want to label it, but, mid-30s or so on, we start to get these aches and pains. So pain is a common phenomenon, and we don't really have great medications to treat pain. One of the things that is effective for the symptoms of pain are the opiates. They have a very risky side effect because opiate receptors are important in our breathing and heart centers. So the medication can actually turn off your breathing or turn off your heart, and they're killing a large number of people. In the early 60s, street heroin, people would get addicted to street heroin and then switch to pills. In the US now, people are getting addicted to the prescription pills, and when their prescriptions run out, then they go to the street heroin. So there are lots of problems with addiction and dependence with opiates. Cannabis helps reduce opiate cravings. If you are having opiate withdrawal symptoms, cannabis is helpful. It also works in conjunction with opiates, so that if you have been taking opiates for a while and your body is kind of used to them, cannabis kind of wakes that system up, and so cannabis can be used in conjunction with opiates. And what study after study, including good human studies now, are showing is that when patients are introduced to medical cannabis, they are automatically lowering their usage of opiate prescription medications. Additionally, I mentioned the laws. A good law for cannabis in the US is correlating with about a 25% reduction in opiate-related deaths. Because we have different states and they are all kind of doing their own thing, the, quote, more liberal or more open the cannabis laws are, the greater the decrease in opiate-related deaths. So say in Washington State, where I'm from, we have legal recreational cannabis for adults, plus we have medical cannabis for patients of all ages, including kids with cancer or seizure disorders. The more robust and open the law is, the greater the drop-off in opiate-related deaths. And also, additionally, the older the law is, the more effective it seems to be in reducing opiate-related deaths. And I attribute that to awareness and education, meaning a brand new law does show correlations with the decrease in opiate-related deaths, but the more mature the law becomes, the more familiar the population becomes with the products, the greater the impact on opiate-related deaths. And again, these are all correlations. So if you're speaking medically, but the correlations are becoming extreme, and we're getting just a lot of really good data. So I think that we can safely say that this is a good example of how this plant can help our public health system, because folks are generally using fewer opiates, and there are fewer opiate-related deaths.
In our territory where cannabis is still coming online, we have, the same situation here, not to the same scale you do, but there's a lot of people on opioids here as well. What advice would you give to somebody who is on an opioid and wants to try using cannabis, but doesn't have the access to physicians that you guys do in the States? I'm aware that when you take something like CBD, my understanding is that when it reacts with the liver, it can also it metabolizes and allows more of the opioid to be absorbed into the body. So you have to be careful in terms of when you're taking it and timings. And can you just maybe dig into that a little bit for us?
The drug interaction piece, or where the cannabis is. So you'll read, typically when you get a prescription medication, a lot of the time you'll see, be cautious taking this product with grapefruit, for example. Yeah. There is in the liver a subenzyme system called the cytochrome P450 subenzyme system that metabolizes drugs. And we are seeing in studies, especially with very large doses of CBD, some interactions. The most common one is I believe it's the CYP3A4, which is very common. But clinically, we are not, and I have a few notes on this, so I want to be specific. Clinically, we know that it's not happening at doses that most people are taking. And most of the drug interaction problems are happening usually with folks on seizure medications or lots of pretty heavy-duty medications that the liver is really working hard. In the U.S., we have legal THC in a prescription form. It's called Sativex, and they have looked at over 1,500 patients in double-blind, placebo-controlled trials. We're not seeing any interactions reported with that. So the interactions aren't occurring in large numbers, and a properly monitored patient, it shouldn't be any trouble for somebody who's being followed with a physician. I usually, in my mind, a daily dose of around 75 milligrams or so of CBD. I've never seen any problem with that. So above that amount, clinically, I would start to be more cautious. But if you are somebody who is just trying things out in low doses, we're really not seeing any problems with that. Let me see if I have any. And also comprehensive reviews, up to 1,500 milligrams a day of isolated CBD have been safe and well tolerated without significant effects. Most common side effects of CBD is it makes you sleepy. That's not a good thing in the daytime. It's also dose dependent, but it can be a great thing at night. So, and also because it is a plant product, if people are consuming a lot of it, it can cause some digestive issues. Some people will get a little dizzy if they stand up too fast on higher doses, but these are all of the quote problems that it causes. But the real thing is, especially with CBD products, is they're extremely well tolerated. They're just very, very well tolerated. And we have a lot of data. I think that if you're a clinician listening, yeah, you should be concerned, especially in a patient who's doing high doses, like a seizure patient, for example, doing high doses of CBD with a lot of other medication, you may want to just be monitoring that. But we're really not seeing, clinically, we're not seeing big issues with this.
And can we just dig into dosing a bit? Because I know, one of the biggest challenges.
Absolutely.
You buy a tincture, people don't know how much they're actually getting. You buy a chocolate bar with 20 milligrams of CBD, and people think it's going to change their health. You mentioned 75 milligrams. What, in your opinion, and I know it's different for every person because we have different metabolisms and different body sizes, and it's very much a homeopathic approach as opposed to a one-size-fits-all. But what would your guidance be in terms of the ratios? So is 75 milligrams a day, is that quite a high dose, or is that an entry-level dose? Or
I think of the way I see it, Trenton, I see 75 milligrams as being a moderate dose, but for most people trying it out, I would recommend starting with about a 15 milligram dose, taking that up to 30, you should be plenty fine. THC is working on a certain receptor system. CBD works on many receptor systems. So it also depends, you mentioned the ratios. For THC, if you have it available, always start low and go slow with your dose. We mentioned the pain receptors in the brain and that those receptors are constantly fluctuating. So so to be very technical, the receptor population that these molecules are landing on is highly variable even within the same person. So my receptors right now are going to be different than they are later today, as will yours. So we always use a variable dosing. There are very rarely set doses for these products when treating illness. But for general health, I think 20 milligrams 3 times a day, 15, 20 milligrams three times a day, 25, 30 milligrams twice a day is going to be fine for most people of CBD. With THC, I find very few people have trouble in the 5 milligram range, but once you get up into the 10, even 12, 15 to 20, you start to see folks not like. If you're inexperienced with cannabis, you might not like how it makes you feel. And medically speaking, for pain, very low doses seem to be effective, especially when you're using a product that has both a CBD and a THC in it. Yeah. So just to reiterate, if you have an ability to determine the milligrams, starting at 5 milligrams of THC, even though it's likely too low to have an effect for some people, I think is good, and then gradually titrating up from there. With CBD, I think you can very easily start at 15 milligrams, take that to 30. With a psychoactive dose of THC, I find that the number one thing, and I just cannot overemphasize this for your audience enough, is if you are doing an oral product, you can't take something, wait an hour, oh, nothing's happened, and take more. That will get you, it won't get you in trouble in terms of harming your body, but it will get you in trouble in terms of, oh, this headspace I'm in, I really don't like it, and I don't like it at all. And you may never want to. Yes.
Interesting. Quite a lot here because, dosing with THC comes with a lot of responsibility. And our edibles market underground is starting to grow, but you're seeing products with 25 to 50 milligrams of THC in them, which
that's too much for a beginner. That's too much for a beginner. And so this is one of the good arguments in favor of having good laws so that you can have good testing, have products labeled, and usually patients can. And in the homemade products, they're frequently brownies. But we have tinctures and liquids and capsules. So you have a lot more options in a regulated market to have a good source of your medicine. If it is the same batch, so let's talk folk medicine. If it's the same batch, you need to try each batch. You need to have an idea. But it is very easy to self-regulate once you get used to it. I am not a fan of smoking for obvious reasons. But we also do have non-smoke inhaling products, vaporizers, which do not produce as much of the hydrocarbon residues that are bad for our lungs. The advantage of an inhalation is if you have too much, you only have to wait about 15 or 30 minutes and then you normalize, versus if it's an edible, it can take hours and hours and hours. So ladies and gentlemen, just be very cautious with an edible. Even if you're experienced, be cautious with an edible. It's not going to kill you, but it could ruin your evening.
Yeah, I mean, I know people who've been put off by having a bad edible experience, and the experience of having an edible, you know, you get a full-on body high, which is very good for stress and anxiety and muscle pain. So people do get put off them, and I think I'm not a big into smoking either, and I think edibles are a fantastic way to also introduce other people to the marketplace that would never ever smoke, but there comes a certain level of responsibility and caution. I just wanted to, before we go on to the next thing, I just wanted to quickly wrap up on the dosing. So everybody's open to CBD, and it's kind of becoming generally acceptable that that's okay. But how important is it to have THC into the mix? You know, and when should that be into the mix?
My opinion is that if you can do it with a legal low dose THC, depending on the country, 0.2% THC or less, 0.3% THC or less, try that product first. I will frequently recommend my patients have two separate products rather than try to get one product that does it all. Have two products, have a CBD-oriented product and have a THC, usually in a liquid, so that you can, I know I'm getting 25 milligrams here, and then I can do 5 with this one, and if that doesn't work, I can do 10. But typically, when combined CBD with THC, for pain, for example, you don't need that much THC. For anxiety, you still really don't need that much. And let me just say that the three things I think both CBD and THC combined products do very well. They're very good for pain, meaning they're mildly effective for a lot of people. That's what I mean. And they're excellent for sleep. For an oral product, most people can get good sleep with cannabis. And for some, anxiety, especially on the CBD side, THC can cause anxiety in people who don't like it. Some people don't like alcohol, for example. You're just naturally predisposed not to like it. But for anxiety, I think CBD can be very effective. So those three things, many of us have one of those three things from time to time. So even if I have a patient with MS or migraine headache, for example, pain, one of the things that pain will do is it keeps you up at night. So the cannabis may or may not be helpful for your pain, but it might help you sleep. So because of the way the endocannabinoid system works, and I'd love to get into that here if we have time, it is it's a communication, it's a biologic communication system. Cells and tissues and organs use it to communicate with other parts of the body, so that when you tonify that system, a lot of good things can happen. It may not just be the good thing you want to have happen, say, you know, for my neck pain, it's not really working for my neck pain, but maybe it's helping me sleep, or maybe it's helping with my anxiety. And the other benefit of CBD only products is they're really usable in the daytime. You can really use CBD and you can work and you're not impaired. Some people actually feel that they are enhanced with it, but it does not cause a head high or an intoxication. So,
yeah, let's just want to explore the anxiety thing again, because some people think that cannabis can cause anxiety. We've all had those moments in the unregulated market where, you know, you'll have a joint one day and you'll have a great time, and then a joint another day because you don't know what cannabis you're smoking. And let's just explore anxiety and how cannabis can have a positive impact on anxiety and how that actually happens.
Sure. Firstly, I would say utilize CBD for anxiety. That doesn't mean you can't add THC in. THC can actually create an anxiety effect in some people, and it can create a relieving effect in you one day, and a different type might affect you in another. The other thing which will come once the market is legalized is a class of molecules that the plant makes called terpenes. Terpenes can affect the way that the euphoria feels for the body. Plants make terpenes for many reasons. One of the reasons they make them is to defend themselves from other animals. So these molecules are biologically designed to work on the receptor systems of other living creatures, so that the plant has evolved them over years. So things that tend to help, I feel, just in terms of throwing words out there, pinene, Pinene, smells like pine. Very good to maintain a steady head with a THC high. If you are looking for relaxation and sleep, myrcene, Myrcene, and linalool can be very good. And for folks who sometimes really enjoy THC and then other times they really don't like it, there is a citrus terpene called limonene that can also really affect how the THC side is working. You can get these terpenes from cannabis. You can also get them from other plants as well. So, for example, having a lemonade with your recreational cannabis can potentially enhance that experience, because the limonene is coming from the lemons. It doesn't have to come from the cannabis. There's a lot to say on this, as you can see.
I find it fascinating that the complexity of this is for me all in the dosing. You know, we're such a race culture where everything is racing a million miles an hour. We want instant gratification. We've got a headache, we want to pop a pill, we want it to go. We've got a pain in our arm, we want it to go. And we're paying a price for that. And the thing is with cannabis is it's a journey. You have to embrace it. You have to try different things. And you know, one of our frustrations here is the lack of access to product that is regulated, tested, so we know exactly what we get. I wanted to just moving on from the terpenes. Can you just explain what the difference between a CBD isolate, a broad spectrum, and a full spectrum is? Because that's something that causes a lot of confusion.
Great question. So let's use the example of caffeine, which many of us can relate to. Caffeine is made by the plant, by coffee or the tea plant, for very specific reasons, again, to affect the physiology of other organisms. But caffeine can come in a no-dose pill. You can take the caffeine pill, right? So that chemical has been isolated, taken out of the coffee, and is in a pure pill form. That is the isolate. So CBD isolate is the single molecule of CBD removed from all of the other plant products. So no terpenes are present in that product. No THC is present in that product. I find that CBD isolates are good in topicals. They can be good in topicals, but I find that they are inferior in oral products. And there is now a lot of study, at least a fairly robust literature demonstrating that this is true. You mentioned full spectrum and broad spectrum. The plant makes over 600 different potentially beneficial chemicals. And we've only really done a lot of studying on a handful of them, but none of them have high degree of toxicity. So I like the word spectrum, because all of the plants every plant you have is going to have a slightly different chemical profile. Even the flowers at the top of a plant are going to have slightly different terpene molecules than at the bottom. That's because the plant, certain animals will graze high, so they'll have certain terpenes up there, and other animals will graze low. So even within the same plant, there can be differences in the chemicals. So it becomes medically, we want it to be very precise, but it becomes very fuzzy to deal with studying all of these different molecules. So isolate CBD is very easy to study, and we've got a lot of studies on CBD isolates showing benefits. But without a doubt, whole plant cannabis products are outperforming the isolates by about a 2 to 4 fold margin. And again, we have studies to demonstrate that. One of the benefits of having multiple molecules, CBD is a great example. CBD, when combined with terpenes or other cannabinoids, acts as a network stabilizer for the biologic information. There's something your audience may want to Google. It's called network pharmacology. It's really where the cutting edge in drug design is. So say, for example, cancer patients, instead of using one chemotherapeutic agent, we're now using multiple agents at the same time. And that allows the dose to be lower and the effect to be broader and the side effects to be broader, so that when you are hitting a biologic system with one single chemical pathway and pushing that, such as an opiate pathway or a serotonin pathway, that has a certain effect on the physiology. But when you attack different receptor systems at the same time, it has the effect of stabilizing the communication between cells, the biologic communication. And as a result, and I'd love to do a class on this for you guys, but we can show that there are now ways with artificial intelligence and computer modeling that we can actually study and demonstrate the pharmacologic benefits of plant medicine in this way. It's very exciting. And again, the cutting edge of medicine in cancer and neurodegenerative diseases, they're doing a very similar thing. It's called network pharmacology. Google it, or if you're a professional, email me, and I'd be happy to send you some resources on that.
Great. I want to talk about cancer and cannabis, but just so, I find it very counterintuitive that there are products out there that don't use the whole plant. I think the answer.
Well, I would agree with you, and let's go back to that, because I don't know that I did a good job with that. So for me, Trenton, because no two plants can be the same, I don't know what a full spectrum looks like. So that's all spectrum to me. Yeah. And it's a common word in the U.S., but a sommelier is a wine expert. And in the U.S., the hardest exam to pass are not the medical boards. It's not the legal boards for the bar exam. It's the sommelier exam, and they will lie. And there's a movie on this if you want to Google it. But part of the test is they have a sampling of wines, and you have to taste the wine and not only identify what type of wine it is, but you have to identify what year it was grown and where it was grown. And you can tell all of this from the bouquet. Cannabis also has a bouquet, and I think one of the things we all should be doing is educating ourselves with our nose and smelling the cannabis flowers beforehand. You'll start to things to notice. You'll notice a pine smell, or lemon citrus haze. You'll notice a lemony scent, or some will be sagey, or some will be fruity. They're all going to have, and your particular physiology on that day. I think that is one way to really identify what is it that I'm really looking for today, is that the nose knows. So in terms of spectrum, I like the term spectrum products, meaning more than just one molecule. But like there's a color spectrum with plants, you can't have all. For example, is a plant with 10% THC full spectrum? What about a plant with 15% THC? Well, 10 doesn't seem full to me if we're thinking of it that way. So I like the term spectrum. Your medicine in general will be better when it is a spectrum product, meaning it is a whole plant derived product. And again, there's good data on this now, thankfully. So.
Very interesting. Let's talk about cancer and cannabis. The research that's been coming out recently is just mind blowing, and I still can't get my head around the fact that it is really helping with cannabis patients, and we're still in the early phases of this, and it makes me quite angry that the plant has been legal for so long when we look at the research coming out. Can you just give us a bit of insight into how it is helping people?
Sure. So I always caveat first with it's still too early for us to say cannabis cures cancer in humans. We need more studies. We can say that it cures breast cancer in laboratory animals. I knew you were probably going to ask this, so I just have a study, and email me if you want this. This is a study where it was a brain cancer study, and it was a CBD THC combined product.
Yeah.
The folks who used cannabis after 1 year, 83% of them survived. The folks in the control group that didn't use cannabis, only 53% of them survived. So the patients using cannabis in this study for this particular type of cancer, their median survival was almost a year longer than the control group. It was a well-designed study and improved survival and also improved quality of life. So it's increasing the number of good days. Now, I don't think you should take cannabis to cure your cancer, but if I had cancer, I might feel very differently. I think that you can use cannabis while you have cancer, and there may be some benefits. I do want to talk about some of the molecular mechanisms because they're fascinating. Both we'll use an example of THC and we'll use an example of CBD to show how the spectrum might actually have some improved benefits. There's something called a sphingolipid rheostat. And in cancer cells, when THC is exposed to, when THC lands on the receptors in cancer cells, it does something called, it creates something called a ceramide synthesis. Nor in the mitochondria, and the ceramide in the cancer cells literally turns off the energy mechanism. So it would kind of be like one of those low jacks on a car where they can literally turn your car off from a satellite, hit the button, and the car turns off. So this sphingolipid rheostat in the cell tissue lines is literally causing the cancer cells to turn off and die. So that's just one of many mechanisms. Another mechanism is CBD. CBD, one of the things that makes cancer very hard for our body to fight naturally is that the immune system can't see it. It's like Lord of the Rings. When Frodo put the ring on, he became invisible. Cancer cells are largely invisible to our immune system. They can't surveil it. But when CBD is entered into the mix, all of a sudden the cancer cells become visible to the immune system. So it's kind of a decloaking effect. So when we use a CBD and a THC, for another reason, maybe for nausea and pain control, you may have these other residual benefits. And I think that it's clear clinically that patients are getting some residual benefits. We just don't know who and we don't know why. Additionally, both cannabinoids affect something called angiogenic growth factor, which tumors use to grow blood vessels. If the tumor can't grow new blood vessels, it cannot grow fast. So by slowing that system down, you slow the growth. And so, as I mentioned, the multiple molecules hitting multiple pathways in different directions. I really am honest with my cancer patients, and I always tell everyone, and I say in every video, you can't say that it cures cancer in humans. But that doesn't mean if I had cancer, I might feel differently about my approach. But what I can say is that if you have cancer and are using cannabis, it can probably help with nausea. It can probably help keep weight on. It can probably help you enjoy your food. It can probably help you get a good rest. If you have bone pain, it might be able to help with that. If you have anxiety or depression, it might be able to help with that. And we now have studies in humans showing non-specific benefits, shall we say, with extended extended duration of good, healthy days.
So it's certainly not necessarily a silver bullet, and I think that, as you say, there's a lot of more research being done at the moment, but the signs are promising.
It's not a silver bullet, but it is a synergistic shotgun, meaning it's hitting multiple targets, all of them more gently than hitting one thing at one particular pathway really hard.
We're running out of time, but the final question I want to ask you, in the times we're in at the moment, what is your professional opinion on cannabis and its ability to deal with the symptoms of the pandemic we have at the moment, the symptoms of COVID?
Again, we can't point to specific benefits, but we can point to general benefits. So, for example, one of the things that is happening with COVID-19 is called a cytokine storm, where the immune system is just attacking all of the organs. Cannabis, and specifically CBD, is a very good immune balancer. So there's something called cell-mediated immunity and humoral immunity, and it tends to balance those. If we have an overactive immune system, it brings it into balance, which is one of the reasons it may also be helpful in autoimmune disease. It inhibits platelet activating factors. So another one of the problems is that the blood is getting very sticky, and that's causing all kinds of vascular issues going on. So although I would never say it does that for I would never say we need to treat your COVID with CBD. If you're taking CBD, it might have that benefit. Cyclooxygenase and prostaglandin inhibition, so it's working as a global anti-inflammatory across the board. And also the virus is landing on an angiotensin receptor. The CBD will also land on that receptor, so there is some thought process that having CBD on board, occupying those receptors, the virus may not be able to gain entry as much. These are all cell tissue studies. We don't have human studies. It's far too early for that. But again, I would say that if you are either have COVID or are at risk of COVID, and you can find other benefits from the plant, such as, pain relief, really good for aching muscles. A lot of people will get sore muscles. The pain in the back of the neck, a topical can be very helpful for that. So you can use it for its known benefits, and the potential for residual benefits is there, but we can't really specifically say, yeah, it's really going to do this. And especially in the US, where we have just a lot of bad information and misinformation, I have to be very careful about what I say and how I phrase this. But I think in conjunction with cannabis, instead of going for a specific health effect, we're talking about a general health and balancing stabilizer. And maybe, I know we don't have time today, but maybe if we had time at another visit further down the road, we can talk about the hows and whys of how this system works. So,
yeah, it's fascinating. I think we're certainly in a time where, from a physiological perspective as human beings, we really need to up our game in terms of personal health and wellness. From the food we eat to the products we use on our skin, we've really allowed it to go too far. And what's happening at the moment is quite a big slap across the face and a wake-up call.
Please, everybody, listen to what Trenton just said. I think that's the best benefit. One of the best benefits of cannabis is that in this endocannabinoid system, for reasons we haven't had time to discuss today, but that it does allow us to manage our own internal physiology despite a wildly chaotic external environment, whether that be stress from COVID, whether that be economic stress from a global recession. These things affect our health. To more personal issues, how does my body deal with low blood sugar, for example? CBD has some blood sugar stabilizing properties. The endocannabinoid system is intimately involved in the adrenal response. When you block the ECS, the cortisol, the stress hormones instantly rise. Likewise, we know that if the ECS is humming along like a finely tuned machine, those people don't experience as much of a cortisol level. And also if we do, and these are human studies, self-reported stress ratings. So rate your stress on a scale of 1 to 10. The higher you rate your stress ratings, the more poorly the endocannabinoid system tends to be functioning. So it really is, what I love about it is a system that is going to give us insights into lots of the holistic practices that we know are good for us. Now we're going to know why. For example, chiropractic type manipulation helps the ECS. Acupuncture has been shown to tonify the ECS. Good fats, omega-3 essential fatty acids, can tonify the ECS. And so if you're having a particularly stressful moment physiologically, supplementing your endocannabinoid system either with cannabis or with a health promoting modality or nutritionally can really have broad, again, we're talking about broad benefits.
Yeah. I think it comes down to one word for me at the moment, and that's balance. We really need to find that equilibrium, which we've lost. So I think we need to learn from these times, and cannabis is a fascinating part of the journey, and the timing couldn't be better because I think it's needed more than ever before in this world. And it's also, I think, important to contextualize that cannabis is not for everybody. You know, on a recreational level, especially, some people it's just not for. It's not a fix-all for all the world's issues, but it certainly can help move us into a more positive space in many ways.
Absolutely, absolutely.
Dr. Jake Felice, it's amazing to speak to you. You are like an encyclopedia of knowledge. In terms of cannabis, I don't need Google. I could just ask you. But, you know, you've clearly put a lot of time and passion into this space. And we really, really appreciate you spending time with us and sharing the knowledge with us.
It's my pleasure. As I mentioned before, I think this plant has so much to do. And let's also remember that this plant is a food producer as well as a carbon sink. So we can feed the planet with hemp, not only just humans, but animals as well. So it has, and there are industrial applications, et cetera, et cetera. So let's chat again soon. There's always more to say. Thanks for having me on, and I really appreciate your time today too, Trenton. Thank you.
Cool. Hopefully we'll get you down here for a surf at some point. Not that
I
I'm
would
a
love
surfer,
that.
but I know some good guys.
Oh, yeah. Oh, good. Oh, good. I'm just an old longboarder, so, you know, a nice, mellow 4-foot wave, and we'll be good.
Perfect. All right, great. Thanks so much. Take care. You are watching Craft Cannabis TV. For more on Cannabis TV, on cannabis things in the world, check us out on YouTube and share and like and love cannabis.